the University of Greater Manchester, formerly known as the University of Bolton, and I teach medicine and I teach public health. So that's a bit about my background. I would appreciate if you could write few words about yourself in the chat box, just like what you're doing currently, so that I can more focus on, have a better view of your background, and I can focus more on what is required for teaching you. We'll sort of skip this bit, and then I'll come towards your learning outcomes. So what are we expecting from you? That is what you want to know, okay? So in this whole unit, we try and take you through person-centered working, and don't focus on these. So this is what we will work on, and this is your assessment later on, but we just were focusing on what you'll learn. So the first learning outcome will be working on person-centered approaches. The second learning outcome, or the second session which will happen tomorrow, will focus on the understanding of the use of effective communication in health and social care provision. How do we use communication? The third is how to know how to reduce the spread of infection. So infections are everywhere. How, do we know? If we don't know that, we need to learn that. How do we reduce the spread of infection? Not only to save our patients, but to save ourselves as well. And if we are safe, our families, extended loved ones, they remain safe as well. And then the fourth is understanding the working conditions or relationships in health and social care setup. The fifth learning outcome is understanding the principles of care planning. And the
Hello,
sixth is...
can you hear me now?
Yes, I can.
Okay.
Yeah. Yeah, welcome to the session. A quick introduction, if you can just write down in the chat box about what you... it's like your attendance as well, which I will take at the end, but I would appreciate if you could just write your name in the in the chat box here. And we can go from there. Yeah. So thank you. So the fifth is understanding the principle of care planning. And the sixth is to understand the safe administration of medication. So you need to know this, even if you're not doing it, you definitely need to know this. Okay, these are some of the indicative contents that we'll go through during your 6 learning outcomes. So now we are going to start what person-centered care is. Anyone from there who knows what person-centered care is? I don't want, you can use your mic, you can use the chat box. Just write down what do you think is person-centered care, or what should be person-centered care. Shouldn't be a definition, something that you think, what would you call it? What would you think best describes it?
Well, can we speak?
Yeah, you can speak, yes.
All right. I think person-centered care is a care you provide to someone according to their preferences, where you have regards to just their preferences, such that they are involved in every decision regarding their care.
Brilliant. Yes. Thank you. Anyone else? Okay. We'll go on from there. Thank you so much. Yeah, that defines person-centered care. And person-centered care is different. Obviously, it differs according to the person, their circumstances, their situation, the person, their age, their gender. I went into a clinic once, and I was wanting to have an assessment, a physical assessment, and that involved obviously gynecological assessment as well. And there was a male doctor there, and I refused. It wasted. That was a waste of my time, my resources. I had to travel to the hospital, and but that did not give me a good impression, because that was not a person-centered approach, where they should have considered gender, they should have considered culture they should have considered. Even to this extent, you can consider, even if there's a person who has a specific gender preference, like let's say if there's so if there's a person who's let's say a transgender. Okay, so these things are relatively new to us, but they are there. Okay, and we have to accept, we have to come to terms to them in a way that we will have patients like this, no matter how uh, problematic it becomes for some people, or even some people might be okay with it, but for some people it might be an issue. But with your profession, you have to be very straight. You have to be very ethical, where you do not stop care. The process of care cannot be stopped at any circumstance. Okay, so this is something, there's some emerging views and some emerging ideologies that should not come in your way when you're supporting a patient. Okay, I know of people who have actually left the patient to suffer because the, uh, mm, they did not approve of whatever they had. The patient was not clean, let's say. The patient was not. We see these things, instances so much on YouTube where there has been instances of very gross negligence because the patient can't have a say. Every time you every patient that you have will not be as vocal as you, or as healthy and as informative, have all the information as you. So you have to keep all those things in mind. We'll not get into this depth, but coming towards this unit's aim. So it aims to develop your understanding of the key features that are involved in delivering safe and consistent. Remember, you're delivering safe care, but it has to be consistent. So it doesn't vary from one person to another. You can tailor it according to the patient preferences, but your quality should be the same. It should be consistent throughout. And this unit also looks at the fundamental principles such as person-centered practice and safeguarding protection. Safeguarding is not my duty, it's not your duty, it's everyone's duty. Remember that. As well as effective working relationships and communications that underpin the work of all health and social care workers. So what is person-centered care? So it is about focusing on the needs of the person rather than the needs of the services. So it is about developing a plan of care with the people, and this plan fits with what the person is ready, willing, and able to action. So there's a person who is a late is a morning person, and you want them to have like a medication that uh, is later at night, or you plan you plan some services with them later in the day, but they're more comfortable in the morning, that they have their children off to school and that works around them. That's the best way. um, so you have to go that extra mile. um, let's take the example of someone who wants to quit smoking as an example. Person-centered care will mean that the person is an equal partner in their planning. When you make the person an equal partner, it encourages them, it makes them feel accountable for their actions, and this will help you a lot in your practice, where you are not doing everything, you are leading, and the patient is also in the lead position to help that change happen. This does not mean that what the person says goes. This does not mean that everything that the patient wants will happen, but it does mean that the person's individual situation and their needs are understood and they're taken into consideration whenever you're planning a care process with them. It may require that the provision of some very tactful health education information is there. Okay, so you need to make, if you're giving health education, you need to make it very attractive for the person. A person will not quit smoking if you tell them to just quit smoking. What is their incentive in that? You need to show what are the positives behind that. They know that already, but you need to magnify that. Only if you magnify that and you enhance that positive, that is the drive that will take them through the process. Okay. And then personalization, relationship centered care. So, what is personalization? It refers to the process by which people with long-term illnesses or conditions, they receive support that is tailored to their individual needs and wishes. So there was a paper, Putting People First, in 2007. The government outlined its vision to improve adult social care, and that is by adopting a personalization uh, agenda. So, what was it at its core? So, it centers on the notion that supports and service where services should be designed um, in a way that they involve those who require them, and they should be tailored to their unique needs. So, there's an old person, a very old person. What services would you provide to them? You will not provide them to go to the gym. No, probably not. But you might give them some recreational activities, some other recreational activities that may help support their mental health and their physical health also, obviously, to some extent. But you will try uh, to reduce the stress on them, and you will try and improve their physical and mental health. And what are you going to do that with? You're going to do that with tailoring your care. Okay, so when you're tailoring your care, you're giving options for care. So you're not actually imposing anything on someone, you're actually providing options there. And these will help you in the longer run. Trust me, when you're doing these in the longer run for these patients, they'll always support you, they'll always give you the strength, and they will help you in the process. So when you are helping someone, there's someone helping you as well. The patient helps you. And this is a brilliant example where there's an old aged person and you're supporting their care. So, what's the best way to support their care? Give them the incentive. Tell them you want to live past 80, you will have to hit the gym. If you can't do that, you will have to go to this activity where there's lots of people of your own age. So if you're buddying them with younger people, that makes it a bit hard, isn't it? That won't be possible. So you're tailoring it, and then you're buddying them with people of their own age who they will be more comfortable with when they're meeting them. And it's more reassuring that if they can do it, I can do it as well. Okay. So just this way, as a child, let's say childhood obesity, if you want to reduce chances of childhood obesity or the prevalence of childhood obesity, what do? You actually buddy people. You won't keep in as partners the child with an athlete, let's say an older athlete. No, that child is going to not relate to that. You keep a child with a child and then give examples like, yes, you can achieve it, you can do it. So, yeah, we're coming back. So, what happened? So, this is how you tailor things to their unique needs. So, it is a move away from one size fits all approach to care, and whereby people have been required to fit in the pre-existing and uniformly designed support systems. And this may or may not meet their needs and offer little in the way of choice of control. Um, Again, as I said, I'll give you my example. I had to fit in that GP um, with my physical examination, which I was not comfortable with. And that put me off quite a lot. So it was easy for the GP, but in the longer run, is it? No, they're not going to get a good response from me. They're not going to get a good feedback from me. So This is how you try. This is how you might make mistakes, but always remember, if you treat the person as a person and not as a patient, this is what will be a winning situation for you and for them. So one way of supporting people is to design their own package of support, and that is through person-centered planning. So now we explain the importance of person-centered values when working in health and social care. So it's about providing care and support, and which is centered or focused on the individuals and their needs. We are all individuals, and just because two people might have the same medical conditions, for instance, both two people might have dementia, but there's a female who has dementia and there's a male who has dementia. They have different care needs, they have different support needs. To work in a person centered way, you have to develop a clear understanding about the individual that you are supporting. This will include their needs, their culture, their means of communication. There's a person who is deaf, they don't understand your language, British Sign Language. There's a person who speaks Japanese, Chinese, Urdu, for instance. They won't understand English. So you need to have an interpreter there. Their likes, their dislikes, their family, and other professionals' involvement. So you can promote and provide person centered care and support. There are 8 person-centered values that support person-centered care and support, and these are, we'll talk about these. So there's the first one is respect. Respect comes everywhere. It's the first thing, first and foremost thing, right? So respect, what is this? What does it mean? It means showing an individual that you will support them in what they believe is most important to them. Whatever their age is, whatever their culture is, whatever their disability is, their gender, their beliefs, and sexual orientation is. Sexual orientation, I talked about this earlier. Yeah. And age is very important. So I took my mother-in-law, who is 70 years old, and she went to an orthopedic surgeon, and she is disabled from her left arm. She had a surgery and she can't, her left arm does not work. I give examples, personal examples, because they're close to my heart and I can relate to them, and um, I can give you first-hand information. So it helps. Um, so what happened was that she said, the surgeon right away just said, well, have you thought of of an artificial arm for yourself, a surgery? We were not expecting that, by the way. We were just expecting some medication because she was in pain, some increased dose of cocodamol, for instance. That's a painkiller. And she said, no, I'm just old and I want to live the rest of my life in with with not that pain which I'm suffering from now, and I've never thought of surgery. And I don't think I'm of that age where a surgery would help me. And right away that I was very pretty impressed with that surgeon who said, we don't take into consideration, um, we don't discriminate on the basis of age. So he said there are people who are 90 years old and want knee transplantation. um, so we do that for them, and they're happy because it releases them of their pain and they're not disabled anymore. So this is what we need to do. We need to eliminate these things, and we need to focus on these things. Okay. So age should not be a barrier. These things, these cultures, disability, these should not be barriers. And when working with other people or professions, never ignore the individual you are supporting. So every individual is separate, okay, and distinct. Always include them in the conversation, irrespective of the subject. Never use a term of endearment like calling an individual love or dear without asking them what their name would be or what they would like to be. I don't like to be called that way. Um, and I don't call someone like that. Okay. But that is my opinion. But your opinion would be different. I can't impose my opinion on your opinion because you're an individual. I'm a separate individual. So always make sure, if you ask the person, can I call you by this name? And always stick to it. Okay. That is professionalism. But as that is also respecting the person for who they are, for what their likes and dislikes are. Some people dislike terms of endearment, others will approve as part of their everyday language, and they'll feel even better. Like, you might call someone, if there's a person who who you think, or you if they're okay with it, you can ask them if they're okay with calling you by this name. Let's say there's a patient who's called Jessica, and I just call her Jess. Yeah, Jess, how are you? And I'm seeing her for the first time. She's me seeing me for the first time. Would she feel comfortable? I don't think so. So always remember, can I call you this? Can I call you Jess? That's better. Okay, so then you come to terms. So either way, never assume it is acceptable, and it is essential to check when you meet them first. The second after respect is dignity. Dignity is what we feel when we are respected, and it is what makes us feel important in the society and in our lives. So, whether individuals are eating, sleeping, washing, shopping, or dying, care and support workers must help them to feel dignified at all times. Okay? So, if there's an old person, remember there are people who are vulnerable out there, and it is our duty to provide them all the respect and dignity, because remember, you will be in their place one day. Okay, and it's a cycle that repeats itself. So you do good, you get good. That's everywhere. um so always remember, keeping people first, and be aware of the importance of preserving an individual's dignity. Ask them how they wish to be addressed. As I just said, don't rush people, and take time to listen to them. At times we go to our GP practice, there's just 10 minutes left. Okay, there's 10 minutes left, but that does not have to be reminded over and over again. If you use some subtle, dignified ways to end a conversation, that will be very well taken. Use towels or clothing to cover them when you're performing personal care. When I practice with my students, we have mannequins. We don't have real people. We have dummies there, models there. And if there's if there's a body there, just a body there, they lose marks if they practice on the body, on an artificial body, without properly dressing it or without properly giving it the dignity it requires. That is not giving dignity to the body itself that is artificial. That body won't complain, but they're going to do the same with the real patient. So this is why it is so important. Um, and it is important not to stereotype or make assumptions about individuals and their needs. The third, after respect, dignity, is individuality. Assumptions should never be made about an individual. They should never have to fit in with you or your employer. Okay. So sometimes it is difficult. Sometimes you may have to tailor things according to your requirements. Okay. So there's a patient who can only be seen at nighttime. If you are not going to be there, you need to make arrangements for them. Excuse me, for them. So there are different ways where you can try and help. Maybe you're not there, but you're there to support. Maybe your phone call can help, etc. So individuals should be allowed and supported to make their own choices. Care and support needs should be tailored to suit each individual. This shows that you are respecting, and you're doing this by preserving the individual's dignity and individuality. Their personal beliefs should be respected at all times. After that comes privacy. So every individual should have time and space to do things in private if they wish to do so. Like they're talking to their family, you leave the room. They're talking to their friends or making phone calls. Doors must be closed when personal care is being carried out. Okay. Again, I'll give you an example. Um, I had my daughter. She had a physical examination again, and there was a male doctor there. Although she's young, but I don't approve of a male doctor. Some people might approve of a male doctor for a child, a minor child being cared for, being checked, completely checked. But I was not comfortable. And the worst part was that like these are small things that you pick up as, because I'm in the field, but even when you're not in the field, you do pick up these things. um there was a bed where she was asked to lie down to be checked, and the curtain wasn't drawn. Like, and the door was, it was just anyone could come in or go out. So I felt really it was not professional at all. And um, what I need to do next is to raise my voice, raise my concern, even if it costs. I won't obviously want that person to lose his job, but I will want care to be given in the right way. Okay, so privacy is very, very important. What they could have done is ask for a female doctor to come in, check whatever parts they wanted to check, or they could have drawn the curtains. That is basic, a basic privacy that is required. You should always knock on doors prior to entering. This is what we do normally. Why can't we do it with our patient? Why? Because our patient is not as superior as our bosses. No, we have to deal with them with privacy. And then there's choice. So what is choice? So each individual you are supporting should be allowed and supported to make their choices. They should never be given, they should be given enough information to make informed choices about, for themselves. Um, and you must acknowledge the benefit of their choice. Give them a decision, but then ask them, is it okay with you? Are you okay with this plan? Never, sorry, never take over because you can do things faster or because you think things should be done in a particular way. Always involve the individual in decisions about their care and support. Sometimes people will be overwhelmed with choice and may respond better if you give them two simple choices, but it is better than giving no choice at all. And it is important to be able to communicate and listen effectively. Then a bit about what human rights are, a bit about the Human Rights Act 1998. So according to this, each individual you support has a right to say no, the right to have a relationship, the right to have a say in how they are supported. Okay, so this is again individuality. They have a right to choose what they eat and how, when, and how they want to dress and when. They have the right to choose their friends and what they want to do with their time. You may have to make changes to take an individual's rights into account. You may have to balance an individual's rights against your responsibilities and can consider if either they or you are at a risk. If you are concerned or unsure, check with your senior always. Then comes independence. Allow the individuals you support to do things for themselves, even if they are small. Being independent does not mean always being completely alone, but supported to do things for themselves. Take time to enable the individuals you support to be independent, to do things for themselves. Don't do things for them because it is quicker. Support them to do things that they can do or almost do. Now, if there's a person who can't walk without a walking aid, you can't expect them to walk on their own. Okay, that's not at all acceptable. So independence makes people feel in control of their lives and gives them a sense of self-worth. Then comes partnership. As I said, working in partnership with other professionals, with colleagues and families, it's an essential part of providing care and support. Person centered care and support is about a whole range of people working together to improve the lives of individuals. And partnership is all about the individuals you are supporting, and all of the partners involved will need good communication. Sharing appropriate information, putting the individual's best interests at the center of everything that everyone does. Now we're going on to analyze how person-centered care or person-centered ways of working contribute to continuity of care. So according to the Department of Health, 2015, Person-centered practice puts the person at the center of everything that we do. Okay. And it's very important. So you're recognizing the person as a unique individual, and you're recognizing what they can do and what they cannot do. Then you have service users who participate in their own care, dignity, and delivery of services, and you're improving the care experience and quality. Um, and care provided in coordinated manner by involving different practitioners in different care settings without disruption in the backdrop of complexities of healthcare settings is continuity of care. Person-centered care involves the user of care, family members, care providers, and they communicate and coordinate healthcare by planning and deciding the way care will be provided. Since everyone is involved, therefore, user of service or the patients have knowledge what and how the service will be delivered by care providers or by yourselves. Needs are being recorded, so you're recording their needs. What do they require? Followed the plan of action accordingly. And since the user of the service or the patient, they're involved, therefore, responsiveness is likely to be higher. And service users and care providers reviews and the services, and they may decide about changes if required. So you're working as partners with them. Okay, so you're working on a task, and you see how they achieve it, and you see if there's any alterations that that require being made. However, it may seem easier, but it requires effective communication and participation. Person-centered care involves multiple stakeholders, and it requires regular interaction and more time to be spent on each patient. It is a hard process, okay? So things that are harder initially, they become easier later, but they will definitely become easier if you continue doing them. Through person-centered care practice, practice continuity of care becomes easier because of active participation. There's more involvement of the patient, their coordinated efforts, and willingness of users to move in a set direction. It also reduces the chances of disruption of care services, like before discharge by healthcare practitioners. Social care team is well aware to take over the change and provide residential care to the discharged patients. An example of person-centered care is this. I will end here. We will, no, actually, yeah, I will end by on this slide, and we'll do safeguarding tomorrow. So this is an example of Malcolm. I'll give you this example. You can read it at home. This is just read it at home and tell me, what do you think? How would you do it, and how if you would do it any way different? Uh, okay, so I'll skip this slide. So just have a read of this. Just save this picture that I've sent in the chat box. Just read about Malcolm and read about what will you do in Malcolm's case. Okay, so he has specific needs. You need to see them, and you need to decide what you would do best in this case. Last slide is, why is person-centered care important? There are different reasons. So it's important because patients, they feel more comfortable and confident in your service. They will always want you. They'll give you a good response every time, and they'll give you good feedback. You will meet their emotional, social, and practical needs, and you can support those who may not be able to directly communicate their wants and needs. So you are having patients who are coming with dementia, their learning disabilities, the patients with ADHD, for instance, when you're giving that care, you're getting more out of them, and it improves their independence. Not only is it this beneficial on a personal level for the patient, but it also encourages them to take part in decisions, and it raises their engagement, which will help you reach better, more suitable decisions relating to their care. It also gives them the confidence and ability to look after themselves with less input from you, which is very rewarding as well. So I'll stop sharing here, and I'll stop recording here.